Vice Chair Murray.
Thank you. Emily, thank you so much for being here to share your story and Charlie's story and your experience at Seattle Children's. I can't imagine what you've gone through to make sure Charlie got the right care and treatment. And I'm glad to know that thanks to the National Cancer Institute clinical trial, she is now cancer-free. But we know that life-saving cancer clinical trials are on the chopping block. In less than 100 days, the Trump administration has terminated 55 NIH cancer research grants. That's more than $137 million that has been ripped away from researchers in 18 states. And on top of that, the leaked budget from this administration shows they plan to cut NIH funding nearly in half. So, Emily, if half of the cancer clinical trials were suddenly canceled, what would that mean for patients like Charlie and the people you know on the cancer ward at Seattle Children's?
It would be devastating. There's no other option often than a clinical trial. And how can you look at these families and say, we're taking away the only option to save your child? There's no funding. It feels like the government doesn't care about families like ours if they take that away. It will be futures like left in the balance.
Yeah. Thank you. Thank you for being here. Dr. Parikh, for the last 3 months, NIH has awarded billions of dollars less in funding over the same period from previous years. For a 10-day stretch in February, NIH did not award a single grant. That is unprecedented for an agency that typically awards about 60,000 grants a year. And meanwhile, President Trump has fired or pushed out nearly 5,000 NIH employees, including grant administrators whose job it is to get that funding out the door. So I wanted to ask you, at this rate, do you think NIH will be able to spend the $47 billion Congress passed and President Trump signed into law?
Thank you for that. If the will is there, they can, because I know the program folks that are still there, and they will work harder than anybody to work with the scientists in the field to do the peer review, to get those dollars out, because those dollars are not about just getting money out the door. It's about funding the ideas that have been proposed. And there are plenty of proposals. There are plenty of good ideas. We don't fund enough. The pay lines are already at 20 and 10%. We need to make sure that we do get those dollars out, because otherwise it will be impoundment by default.
Well, we know that they have canceled peer review panels and they're firing staff. So can they get that funding out the door effectively?
Only if it becomes a priority. Only if it becomes a priority. We have to make sure that it can go out. I'm confident that it can if they make it a priority. I have not seen that yet. The they is the NIH administrators, the leaders, and the Department of Health and Human Services. We have to be able to say that we are going to start awarding these grants at the rate that it requires to get to the fully appropriated amount that you all approved at the end of last fiscal year.
To your knowledge, has that been done?
Not yet. The rate isn't quite there yet.
Okay, thank you. Dr. Sleckman, let me turn to you. After 34 years, the Trump administration announced it was going to stop the Women's Health Initiative. That's a long-term, first-of-kind project that was launched actually in 1991 to study cancer and heart disease and osteoporosis in postmenopausal women. And thanks to that research, 126,000 cases of breast cancer and 76,000 cases of heart disease were prevented over a decade. The Fred Hutch Cancer Center research in my state is the clinical coordinating center and one of the 4 regional centers that was told last week that its funding was being terminated. Supposedly it's back, but that is very unclear right now. The annual funding for these centers costs about $10 million. That's less than half, by the way, of what taxpayers spend on President Trump's golf trips, just in case you were keeping track over the last 3 months, but $10 million. How important, I wanted to ask you, is sex in the diagnosis of treatment of cancer? And do you think now is the time to be cutting breast cancer research?
Yeah, thank you for that question, Senator. Let me make a comment first about the women's health study. These types of studies are essential for cancer and understanding the basis of cancer. This is a very long-term study, not a 5-year grant, something where they've been following women for decades and using that information to understand about cancer risk and then make informed decisions about cancer prevention. These types of studies could only be funded in a large, organized way through the federal government. the NIH, and the NCI. I think getting back to your question is that it's extremely important to study the differences, biological difference between men and women when it comes to cancer risk, cancer progression, and cancer treatment. Extremely important. There are large groups at pretty much all NCI cancer centers that either take that into account when they're designing a trial or are studying it specifically. Absolutely important. Thank you for that question.
Thank you very much.